Hello, this is Dr. Steele. Today I want to talk to you about white coat syndrome. White coat syndrome is when a patient goes to a doctor, especially doctors that they don't see often, to their clinic, and their blood pressure is elevated. However, when they go home, the blood pressure normalizes. So it happens a lot with patients that go to see, for instance, a doctor. Let's say I'm treating the patient for hypertension as his primary doctor or her primary doctor. They come to my clinic and everything looks good. Suddenly there's a change in their EKG or something's off, and we get them to be evaluated by a cardiologist. They go to their settings and they feel anxious. This is the key word, anxiety. They feel anxious. They go there and their blood pressure is elevated. And if you're not careful, you start giving medications for the high blood pressure, which the patient didn't need. It was just something that happened because they were not aware or they didn't feel comfortable in their surroundings. So it's very important for us as doctors not to jump the gun per se, not to start giving medications to a patient that comes to your practice and their blood pressure is elevated, and all of a sudden let's just prescribe medication because medications have their own side effects. It's better to just tell the patient, okay, your blood pressure is a little bit elevated. I want you to do a blood pressure log. I want you to take your blood pressure several times, especially in the morning when you wake up. I'll see you in 2 weeks, or how many weeks you want to ask the patient to do, and then come back and give me those readings. And you'll be surprised how many patients don't have hypertension or elevated blood pressure. So it's important to remember that because medications, as I mentioned before, have their own side effects. And it's not good to overtreat patients with medications when they don't need them. So that's my talk for today. Make sure you don't get anxious when you hear that you have high blood pressure without doing our due diligence, without you taking your blood pressure at home before we even prescribe anything. So remember, the best doctor for you is you. And we're here to help you, but at the same time, we're here to also clarify certain questions that you may have. I'll talk to you soon. That's my talk for today. Take care and remember that the greatest wealth